I'm Bishop Cirillo Flores. It is my pleasure to introduce this presentation intended to promote safe environments in parishes and schools throughout the Diocese of San Diego. Our diocesan policy on safe environment programs embraces the National Charter for the Protection of Children and Young People, which calls for the ongoing training of parents, educators, church ministers, volunteers, and others regularly involved with minors as to the issue of child abuse, including sexual abuse. We want to ensure that our children and young people will worship, study, and participate in church activities in the safest and most secure settings possible. Thank you for all that you do on behalf of the mission of the church, and in particular, for participating in this training program.
Hello, I'm Rod Valdivia, Chancellor of the Diocese of San Diego. With me are Dr. Cindy Kelbs, a pediatrician and Medical Director of the Chadwick Center at Children's Hospital, Detective Jim Norris, a detective in the San Diego Sheriff's Department's Child Abuse Unit, and Mr. Colin Murray, an attorney in private practice who was formerly a Deputy District Attorney in the Family Protection Unit at the San Diego County District Attorney's Office. We are all parents, practicing Catholics, and actives in our parishes.
As professionals, we respond to child abuse every day. As parents, we worry about our own kids. And as Catholics, we want our church to be a safe place for all children. As we strive to implement a safe environment program in our parishes, we need to recognize risk factors and concerning behaviors associated with child abuse, understand our responsibility or obligation to report our concerns, teach our children rules for reducing the risk for abuse, and how to tell a parent or trusted adult if they are abused. Child abuse means simply the maltreatment of children. Children can be abused in many ways. They may be physically hurt by an adult. They may be neglected, meaning that basic needs are not met. This may include physical as well as emotional needs, along with appropriate supervision. Emotional abuse is not uncommon. The most common form of emotional abuse is exposure to domestic violence, although demeaning children or calling them names also constitute emotional abuse. Children may be exploited sexually. This has become more prevalent with the advent of the web and increasing access to the internet. Lastly, children may be abused sexually, usually by someone known and trusted by the child and family.
Abuse and exposure to domestic violence can have lifelong effects. People abused as children are more likely to self-medicate with drugs, alcohol, or tobacco, leading to increased risk of heart and lung disease and cancer. Abused children have higher rates of depression, anxiety, post-traumatic stress disorder, and other mental health problems. They also may have problems with school performance and forming healthy relationships. Abused children may be at higher risk of using violence to resolve conflict. Fortunately, treatment is available to diminish these potential long-term effects. It is important to recognize abuse and neglect in order to help ensure that all children live, study, and worship in a safe, secure environment. Abuse is common. According to a recently released report from the United States Department of Health and Human Services, in the year 2002, 1.8 million referrals were made nationally to protective service agencies due to concerns of child abuse or neglect. These reports represent more than 3 million children. As these numbers only reflect children who were reported to an official agency, this number is actually an underreport of the number of children harmed. Of these children, 60% experienced neglect, 20% were physically abused, 10% were sexually abused, and 10% were emotionally or psychologically abused.
Too often we think we can tell who the victims of domestic violence and child abuse are just by looking at them. It's easy to think that these victims are those people that don't look like us. But abuse affects all groups similarly, regardless of skin color or socioeconomic status. Similarly, perpetrators of abuse come in all shapes, sizes, colors, and professions. Most abused and neglected children will look and act completely normal. Any form of abuse, however, may cause problem behaviors in our children. Substance abuse may be a form of self-medication. Drugs, alcohol, and tobacco are used to make victims feel better. Sexually abused children may exhibit abnormal sexual behaviors that may run the gamut from age-inappropriate knowledge of sexual behavior to sexual requests to inappropriate sexual behavior with peers and to seductive behavior towards adults. Most runaway children have been abused as they try to escape their unsafe environments. Anger, violence, and bullying are all seen more commonly in abused than in non-abused children. An abused child may also be depressed, withdrawn, and sad. School failure and attendance problems are frequently present in those abused. Lastly, abuse may cause a child to self-harm or self-mutilate, and as with drugs and alcohol, this is done to try to make the child feel better. Remember again that most abused children will look normal. In fact, some children accommodate to the abuse by excelling in school or sports, thus avoiding the concern of adults in a position to help them. When these high-achieving children later report abuse, their credibility is sometimes questioned because they don't conform to our stereotypes of what a victim of child abuse might look like.
The best way to tell if a child has been abused is for that child to disclose the abuse. One of the most common ways children disclose abuse is to tell another child. It's not unusual for the child hearing such a report from a friend to tell a parent or a teacher. It's important to report these disclosures and let Child Protective Services and law enforcement do their investigative work. It is not uncommon for a child to delay telling someone about the abuse. This may cause some to question the child's credibility. Children may have been threatened not to tell. A very young child may not realize that her or his experience was abusive. Too often, when children do summon up the courage to tell, the threats the perpetrator of the abuse has made to keep the abuse a secret come true. A loved family member, teacher, or volunteer may be arrested. The child may be removed from the home. The child may not be believed by family members, teachers, friends, or parishioners who blame the child for the crisis the report has caused.
Just as we've said, most abused children will look completely normal to the casual observer, most adult abusers will also look like typical adults. They may be predisposed toward maltreatment as a result of having been abused, neglected, or exposed to domestic violence while growing up. They may lack the life experience to form intimate, satisfying adult relationships, and consequently exploit the only relationships available to them, those relationships with children. Adults who seek opportunities to spend time alone with children or adolescents, particularly those not related to them, may be abusers. Parents shouldn't hesitate to set limits on settings which may make their children vulnerable. It's important to remember that most children are abused by someone known to them, and that often the abuser has access to the child because the child's parents trust him or her.
There are things we can do to reduce the risk of abuse of children in our parish and at home. The Code of Ethical Standards for Church Ministers, published by the Diocese of San Diego, explicitly forbids sexual intimacies and physical contact that could be understood as inappropriate to a professional relationship between an adult and a child. Providing minors with alcohol, drugs, or sexually explicit material. Offering minors overnight accommodations in rectories or other personal residences unless additional adult supervision is present. Maintaining exclusive relationships with minors. Minors who appear to seek such a relationship may have experienced abuse or neglect. Discuss this concern with colleagues in the parish and seek professional guidance for this youngster. A team approach to ministry in which emerging concerns about a child's behavior or risk for abuse are discussed improves decision-making and provides sound risk management. No individual can or should handle these concerns alone.
Children are often abused by someone who both they and their parents know and trust. Those of us who are parents or work with children in our parish need to include the subject of child abuse in general and child sexual abuse in particular when educating our children about personal safety.
Parents often find it difficult to speak to children about unspeakable acts. We worry about taking away their innocence and teaching them about adult sexuality before they're old enough to understand. Parents may wonder if by teaching children about sexual abuse, we will give them negative messages about healthy sexuality. There are, however, effective, age-appropriate ways to talk to children about these issues. For preschool children, it's appropriate to teach them that they have several openings in their bodies that no one should hurt or touch or try to put things in. Parents can do this at bath time and can follow up by reminding them that these are things you need to know about right away if they do happen, even if someone says not to tell.
Throughout the preschool and primary school years, it is important for parents to look for occasional opportunities to tell children that if they ever have a worry or are feeling scared about something, that it is better not to feel scared all by themselves. Explain to them that if they tell you if they are worried, you will be able to figure out what to do. Bedtime or driving in the car can be good opportunities for this kind of discussion.
If children do disclose a possibly abusive situation at home or in a parish or school setting, respond with open-ended questions such as, "Tell me more about that," rather than asking if specific sexual acts occurred. You want the information to come from them.
Be sure to let your child know whatever happened wasn't their fault and they are not in trouble. Older children often know more than we think they know about sexual abuse and adult sexuality from exposure to the media. This can actually make it easier for parents to introduce this topic with children and teens. Parents might say to an older child, "There's so much on television about child abuse and sexual abuse. It makes me want to say to you that if anything like that ever happened to you, I'd understand it wasn't your fault and help you deal with it." Parents often give their young teens books about their developing bodies and offer to answer any questions they still have after reading the book. Consider also having books at home about child abuse. A bibliography of these references is included in your handouts.
As one becomes comfortable talking to children about preventing, recognizing, and reporting child abuse, share your knowledge about child abuse issues with others, such as parents or colleagues at work. Support efforts to develop personal safety policies in community organizations in which your children are involved, such as scouts, music, or team sports. A child in special education may be more vulnerable to abuse than other children.
Families should make rules about the family computer and talk to their children about the fact that some adults might try to trick kids they meet over the computer. Tell them to tell you right away if they accidentally meet someone through the computer who wants to meet with them or ask them to do something that doesn't feel right. Give children an opportunity to save face if their curiosity online leads them to material that isn't allowed by the house or school rules. Thank them for telling you, and if what they have experienced sounds criminal, report it to the police.
Parishes should have materials on child abuse on display. Classroom teachers or catechists might sponsor a poster contest on preventing child abuse for elementary school children and display the posters. High school teachers might consider having novels or biographies on their classroom shelves that deal with child sexual abuse and teen relationship violence. These materials demonstrate to children and teens that their teachers realize these things can happen and that he or she might be a safe person to ask for help. Anyone who works with children in a paid professional capacity is a mandated reporter. In a parish setting, these would include the Director of Catechetical Ministry, the Coordinator of Youth and Young Adult Ministry, the Child Care Supervisor, and any paid catechists or youth ministers. In addition, where there is a parochial school, it also includes the principal, the teachers, counselors, coaches, and every professional staff member. Clergy are not mandated to report abuse they learn of in the confessional. They must, however, report abuse that they learn about when they are acting in the capacity of a teacher, camp counselor, youth minister, or any other duty covered by the mandated reporting law.
Mandated reporters are immune from civil suits if the report was made in good faith but could not be substantiated in a follow-up investigation by law enforcement or child protective services. Under California law, mandated reporters do not have to ask permission to report and cannot be reprimanded by their superiors for making a report. They must call the child abuse hotline or law enforcement at once and comply with the required follow-up. All reports to the hotline are automatically cross-reported to the law enforcement jurisdiction where the crime allegedly occurred. However, if you have immediate concerns for the child's safety, please call the police as well.
Parents and volunteers should report concerns about abuse, but they are not guaranteed the immunity professionals enjoy. Parents and volunteers report their concerns to a mandated reporter, such as a mental health counselor, physician, or other child care worker. In the parish setting, this would involve contacting the supervisor or director of the ministry in which one is involved. All situations of sexual abuse by church ministers should also be reported to the office of the chancellor. Seek confirmation that a report was filed with the authorities. Additional training in mandated reporting is made available to directors of catechetical ministry, coordinators of youth and young adult ministry, and Catholic school administrators by the diocesan offices.
Both Child Protective Services and law enforcement's first obligation is to evaluate the safety of the child. Child Protective Services must decide if the child can safely remain at home during the investigation of an in-home abuse and following any criminal proceedings. While most non-offending caretakers do protect their children, occasionally children are placed in foster care for their safety. After evaluating the immediate safety of the child, law enforcement must determine if a crime is committed, conduct an investigation, and may present the case to the district attorney for criminal prosecution of the alleged perpetrator.
The deputy district attorney in the Family Protection Unit screens the case with the detective, reviews the evidence, and decides if criminal charges should be filed. Child Protective Services follows up by evaluating the child's non-offending caretaker's ability to protect the child. Child Protective Services responds primarily to abuse that occurs in the child's home. The CPS worker must petition the juvenile court on the child's behalf. When children are placed under the protection of the court, the proceedings must include a reunification plan. If the caretakers fulfill the reunification plan, the child will return to their care. CPS may not be involved when a child is allegedly abused by someone outside of the home, such as a neighbor, relative, teacher, minister, or camp counselor. The parents presumably did not fail to protect their children by sending them to church or scouts. Unless parents are uncooperative with the law enforcement investigation of such crimes, CPS will probably not intervene.
If a child confides in you that they are being abused, or you find yourself in the role of supporting a child who has reported abuse, remember to assure the child the abuse was not her or his fault. It's not your job to decide if the allegations are true. As a mandated reporter or a volunteer, your obligation is to report your concerns to either CPS or law enforcement or to your supervisor. The consequences of reporting abuse can be a lonely role for the reporter, the victims, and the victim's family. Be supportive, be informed, and know your resources.
It is our hope that the material in this program will be a springboard for parish and school communities to become ever more aware of the prevalence of child abuse and in particular of child sexual abuse. This program includes a list of available resources and suggestions as to how parish and school groups may make additional efforts in implementing a safe environment program. It is painful for all of us to consider how much so many have suffered over the years, especially when the abuser was a member of the clergy. As people of God, our church today is committed to making sure the abuses of the past will never be repeated. We have been given the challenge of addressing the suffering caused by these abuses, and with God's grace, we will restore the confidence of all parents and the innocence of children by the actions we take today. It is our hope and prayer that education about potential abuse and appropriate guidelines, procedures, and laws for recognizing and reporting suspected abuse will be a faith-filled journey of healing for our church.